Hello everyone, welcome back. Today I am going to share to you some information regarding Osce, which is the exam that you have to take as a part of your NMC registration. In fact, it is the final step to your NMC registration in the UK. So nurses normally preparing to come into the UK have to do their IELTS, and then they have to write their CBT exam, followed by a long list of paperwork that is supposed to do. And after coming to the UK, after a certain amount of training, the final step just before you get your registration or PIN number in the UK is the Osce exam. So I'm just going to give you a brief idea about what Osce is. Osce, if you expand it, it is Objective Structured Clinical Examination, OSCE. So as the name suggests, it is a clinical examination, simply meaning that it is based on UK standards and it is to test your clinical skills or how you handle a particular situation in your clinical area. So for whom is the Osce applied? It is for all nurses and midwives who are planning to register under the NMC if they are trained outside the European Union. Those who are trained inside the European Union do not need to take the Osce, but if you are trained outside the EU, you have to take the Osce, which is your final step towards registering as a nurse in the United Kingdom. Now, like I said, this is based on the UK registration standards. So the examination system is quite different from how you might have experienced back home in your country. But it's basically nursing in itself, and it's quite similar to what you've been based on doing in your nursing as well. Now, the doubts that most people ask is what is involved in Osce. Basically, they want to test how you are able to assess the patients, how you are able to plan for their care, and how you manage to implement that care, and how you evaluate yourself based on the care that you have given to your patients. So simply like how you've been doing all throughout your nursing career, assessment, planning, implementation and evaluation. So that's what they are assessing. So generally there will be 6 stations which will be pre-planned and pre-arranged, and the scenario will be given to you and you have to go through those 6 stations based on that particular scenario. 4 of those stations, the first 4, are exactly like I said: assessment, planning, implementation and then evaluation. So that's basically what it is. The next 2 stations are to assess your clinical skills. That is, you will be asked to do any 2 clinical procedures or demonstrate that to them. So normally here all the hospitals prepare their candidates quite well enough for the Osce, so you don't have to get worried about how the stations are going to be or how it is, how you will be able to do the exam and things like that. You will be well trained by the hospital before you go for the exam in itself. Now, centers. We have 3 main centers in the United Kingdom where you can write the exam. The centers, one is the University of Northampton, second is Oxford Brookes University, but they have 2 campuses. One is in Oxford and one is in a place called Swindon. And then you have one more center in Northern Ireland, which is the Ulster University. So these are the 3 universities that normally conduct the Osce examinations for the NMC. Like I said, the training for this is given by your respective hospitals, and I'm quite sure that all hospitals will be giving very good training before you apply for the exam. Another doubt that many people have is the cost of the Osce exam. Earlier on it was £992, but recently I think they have reduced it to around £794. Now, Osce, like I said, you have 6 stations and you have to pass all the 6 stations. Previously, if you had not passed any of the stations, you have to take all the stations again. But one recent change that the NMC has done is that when you are resitting for the Osce exam, you have to do just that station in which you have not passed. So out of the 6, if you have failed in just one or two, you don't have to take the entire exam again. You just have to apply for a reset, just those two particular stations that you have failed, and it normally is the same exact station that you will be given as well. So that makes it less difficult in your second attempt. So for resetting, the earlier fees was £496, and now the NMC has reduced that as well to around £397. And the results are sent to you via email in about 2 to 3 days, and at the same time it will be updated in your NMC website or in your application portal as well. So after you get your results, what you have to do is go back to the NMC portal or your application page, and then pay a small fee for your NMC PIN registration, and then they will be sending you the PIN number immediately the next day. So that's all you have to do. The number of attempts that you can do for the OSCE is 3 attempts. 3 attempts. So it's the thing is, you have to have at least a minimum of 10 working days gap between the exams. So that is, if you take the exam once and if you haven't cleared, before you attempt it for the second time, you have to have a gap of a minimum 10 working days. That's how it is. So you can have 3 takings of the test, but normally you don't need so much. It's not that complicated. But if you do not manage to pass in the 3 attempts, then you will have to, or your processing will end there. You will have to restart your processing from the very beginning altogether again. Absolutely nothing to worry. You are given proper guidance and training related to OSCE before you actually write the exam. So no need to worry. If you have reached the particular stage where you are coming to the UK right now, don't worry, your hospital will be giving you enough training and you will be able to clear your OSCE very effectively. So wish you all the best, and thank you.